When you come across a situation, or in your role as a first aider, you're called to deal with someone who is unconscious, you'll need to call for help and try and find out if someone has witnessed what's happened. First, you will need to stop, think, and then act. Look for hazards, and make sure any are removed. Look for other potential dangers and things that may harm you in any way. Make sure there's someone with you if possible, so you can send them to call the emergency services if needed. Introduce yourself to the patient, give them a little tap on the collarbone and see if there's any response, and ask them permission to help. If they're conscious, you can talk to them and find out what's happened and stop them from moving while you assess them and decide what action to take. If they're unconscious, make sure that they're breathing. If they're not, you will need to commence CPR. To check for breathing, you'll need to open the airway by lifting the head back. This draws the tongue away from the back of the throat and allows air to pass. Place one hand on the patient's forehead and the other under their chin. Have a quick look in their mouth to see if there are any obstructions. Gently lift the chin and push the forehead back in a smooth, gentle action. Look, listen and feel for breathing for up to 10 seconds by placing your ear close to their mouth, and listen and feel for breathing and look down their body for the chest rise and fall. If they're breathing normally, CPR is not required, but still send someone to call for an ambulance, making sure you tell them to come back and tell you when the ambulance will arrive. To make sure that the patient's airway remains open and to ensure that they cannot choke on their own vomit, you will need to place them into the recovery position. If available, put a pair of gloves on and do a quick head-to-toe survey to check for any injuries. Gently feel their shoulders, arms and chest for any deformity, blood or fluid. Check that their legs are in a normal position and there are no real damage to the hips or legs. When your check is complete and you found no evidence of injury, the patient should be placed in a recovery position as follows. Kneel next to the patient. Ensure the legs are straight and the feet together. Take the hand nearest to you and place it on the floor at 90 degrees to the body. They'll end up resting their head on this arm. Take the hand furthest away and hold it in your hand that's nearest to their head, and bring across their body and hold against their cheek, which is nearest to you. Do not let go. With your other hand, grab their knee furthest away from you. Lift it to bring their foot flat on the floor, and then using their leg as a lever, pull them towards you so that they're on their side. Check the airways open, and if not, tilt the head back further to make sure that they can breathe correctly. Tidy their legs so that it supports them and it makes them stay on their side. From this point, your role as a first aider is to keep the patient comfortable and warm. Remember to speak to the patient and monitor them at all times to make sure they're still breathing. If you're completely alone with the patient and don't have a phone, this is when you would need to leave the patient and go and call the emergency services, but make sure you check that they're breathing when you leave them and when you return.